name is one Muhammad nor Izudeen one Ahmad. I'm from Mechanical, Aerospace and Civil Engineering Department. I'm doing engineering management research and focusing in healthcare technology assessment. So today, my presentation is about designing the hybrid model of user interaction framework for telemedicine system performance in developing countries. So this is table of content. We'll start with the introduction, followed by background and motivation, theoretical basis, the conceptual framework, preliminary findings, summary, way forward, and the last one is the references. So what is telemedicine? This is the definition by World Health Organization, but it can be defined as the use of the electronic communication to provide support for the healthcare services in the remote area, which is separate the participants. It is being widely used in developing countries such as United Kingdom, Australia, US, Norway, and others. However, the developing countries who is already employed this system is struggling and facing a big challenge to implement the successful of the telemedicine. So what is the purpose of this study? Okay, we propose a conceptual model framework for telemedicine system performance, which is based on user interaction concept, and we applying the information system approach. Cool. So my focus area is Malaysia. Okay, Malaysia is situated at the Southeast Asia. The population approximately about 30 million people and is a multi-ethnic population. Malay is the biggest population, more than 50%. Even Malaysia is a developing country, but it can be considered as highly innovative, and the citizen is keen to use the new technology and innovation. So the Malaysian government has started the ICT project, which is called Multimedia Super Corridor in 1996, and it has 7 flagships. One of the flagships is the telemedicine project. So in 1997, the government has, through the Ministry of Health, which is the healthcare provider, commenced a telemedicine blueprint, which is the national model framework for the telemedicine. The conceptual framework is for the future healthcare system, which is harnessing the advancement of ICT. And the key is to emphasize on human wellness and focus on the people, which is the users and the services. So this is the figure that the component involved in the telemedicine localized project in Malaysia, which is there are 4 pilot projects, which is the education. The second one is the CME, which is continuing medical education. LHP is the life health plan, and at the bottom is the teleconsultation project. Okay, as I said earlier, developing countries have the barriers or limitation to employ this technology because of, based on the report by WHO, the first one is the resistance from the healthcare practitioner side. System must be focused on the need of the medical side, not forced by the technology. The incompatibility of the hardware and software, and also the poor system management, organization, and maintenance. Okay, this is also the key point and also the driven factors for my framework. This is the typical telemedicine setup, which is commonly used nowadays in most of the countries. The previous literature, most of the telemedicine setup is use the satellite system, but nowadays they use the network system, which is much more cheaper. Okay, theoretical basis. Okay, user interaction. is a subset of the human-computer interaction field, and it can be concerned as how the user act on the system and the system act on the user. It's a vice versa. It also the user preferences on using the ICT. So the hybrid model framework is the integration of user satisfaction approach and also technology accepted approach, which is two different streams in the IS. User satisfaction factors characteristic can be described as the satisfaction to use the telemedicine based on their interface and processor that will impact to the performance measure. And for the technology acceptance, we can describe as acceptance of technology usage in for my framework in the clinical area, which is also underlying to the organizational performance and which will be affected to the decision making in the organizational management. So there are two theories which is underpinning my model, which is one is from the web-based information system success model from Garrity, which is the original one is to examine the consumer purchasing making decision, and the second one is the unified theory of acceptance and use of technology or UTAT method from Venkatesh. So this key factor from these two models is integrated. This is my framework, conceptual model framework, which is use the broad range of IS factors, which is relating to the telemedicine system performance output, which is net benefit, system expectation, and adoption. Okay, moderators are independent variable, which is consists of the user demographic profiles and also their ICT knowledge. Social influence is the factors from technology acceptance, but it has been eliminated due to the technological factor relationship, and we have replaced with the security and privacy factors from Young et al. I just came back from my field research last month, and this research still in the middle phase. And I have collected approximately 250 survey questionnaires, which is I collect from the healthcare practitioners who is working at 5 hospitals in Klang Valley, which is the central region. And the preliminary findings show that there is opportunities and barriers of telemedicine application usage in Malaysia, and is linked to the output. Apart from that, I have do a pre-test and pilot study, which is done in last year for the validation of the questionnaire survey item. There is some feedback from the respondent, which is for benefit, like respondent 70 claimed that it is very useful to be used by the healthcare practitioner in their daily routine works. Telemedicine is useful, especially to district hospital to connect with referral center and specialists. Respondent 90 is the senior consultant, and he has been used this system for the last 50 years, and he felt it is easy to use now, and telemedicine is mainly available in emergency department, and also they are using the mobile application to transmit and the image if they want to discuss with their colleague. Okay. However, there are also the limitation or barriers with the system. Slow internet coverage, system down. They need to skill the use of telemedicine application. If not, it will make the work slower, so they need the proper training. They also question about the confidentiality of the information and not updated progress. Okay, from this summary, so the preliminary findings show that there is opportunities and barriers of telemedicine application in Malaysia. With the integration of user satisfaction and technology acceptance, it builds a strong relation that distinguish belief and attitude from user perspective, how to improve their performance in using the new technology. And it also can build a bridge from design and implementation with the system characteristic. So this is my way forward. I'm still key in the data, and then after that, I will do my data analysis with the SPSS software. We will examine the precursors and the key factors, effect of the moderator to the outcomes, then segmentation of data based on TSP output. I will present paper at the PMA, which is the Performance Measurement Association Conference, journal submission, and continue with my thesis write-up. Thank you.